Great. Thank you, Marco. And no worries, my surname is always a pain for many people. Today, I'm going to walk you through the EMA social media strategy for the period 2023-2025 that was developed together with a contractor based on an analysis that was also carried out on the performance of our social media platforms, namely Twitter, currently X, and LinkedIn, as well as YouTube and Instagram. As I said, we did carry an external analysis to understand better how the social media platforms were performing and how we were doing and how we were engaging with our followers. And what was noticed was an impressive growth of the followership on all EMA platforms, mostly because of our communication during the pandemic. We did manage to establish the agency as an authoritative source of information on COVID-19, especially on development of vaccines and the results of clinical trials. And we noticed that there is still an impressive base that remains for further growth. That means that we can still attract new followers on all our channels to be informed about the work of the agency. Based on this analysis, the social media strategy aims to position EMA as an authoritative source of information for all social media users. Of course, we also want to maintain and to nourish the community that we already created. So that means we would like to continue connect further with our existing followership. And at the same time, we would also like to grow our community so we can reach additional audiences from different parts of Europe and from different, let's say, age groups and interests. The strategy also established a few key target audiences for our social media communications. We have 4 tiers. We have the policymakers and authorities. Then we have the multipliers, where the patient organizations and healthcare professional organizations are included, and with your help, we managed to disseminate the necessary information wider. Then we have the specialized audiences, such as academics, researchers, healthcare professionals, and of course we have the European citizens, like patients, caregivers, but also farmers or animal owners, younger audiences that may be educated and more interested in our work, and people in Central and Eastern Europe who apparently are more difficult to be reached with our current platforms. A few key insights of the analysis are that we mainly reach a professional audience in Western Europe. So there may be more work to be done to cover Central and Eastern Europe. At the same time, LinkedIn and Twitter, currently known as X, have limited outreach among audiences in Central and Eastern Europe. And on Instagram, there is still a lot of potential to be further used to reach younger audiences with an interest in public health. YouTube is also a very interesting space in the sense that it's an adequate platform to reach younger audiences, but also a bit more mature audiences who are very interested in finding information on how to do things. And Facebook is a platform with the widest reach to audiences in Central and Eastern Europe. But at the same time, maintaining and developing a presence there would come with a very high cost in terms of maintenance, but also resources, financial and human resources to be used there. Based on this analysis, we have now a strategy with a number of recommendations that we carefully analyzed and looked into it to understand what is reasonable to start implementing in the next couple of years. So we have a few recommendations on content strategy for each of these platforms we are present, on community management and social listening, as well as monitoring, and I'm going to walk you through this. So when it comes to EMA's presence as an agency on LinkedIn, we know that this is a platform that is more specialized for professionals. This is a very good platform where we can talk directly to academics and healthcare professionals. And the recommendations we received based on the analysis are that we need to diversify content to be able to expand the audiences that we are talking to, and to use versatile content formats. Or more, let's say, media rich formats. This is something that we are already doing, and we are testing now. We're in a very testing phase because we try to work more with carousels. We are trying to publish more videos and testimonials. And also we are trying to have LinkedIn live sessions on various topics where my colleagues that are actually present in the room today were working on having a very successful interaction. And actually here I want to give a more concrete case study about these live sessions. We had two types of live sessions. One was with LinkedIn News Europe at their invitation, but also at our initiative to address questions from the audience on various topics. The latest on the LinkedIn News Europe was on the mRNA technologies, and actually it was very engaging with a lot of questions from interested audiences. And the advantage of having such a format was that everything was taken care by experts from LinkedIn, so the technical part was already covered for us. And because it was a good format, we decided to try it in-house. We used our current page that has more than 200,000 followers to engage with people and to respond to questions from people on topics like real-world evidence and the work that we do on veterinary medicines. And we are happy to see that we had high engagement, expanded our audiences, and the algorithm is actually pushing a lot this, so it gains a lot of reach and visibility. So this is something that we may test in the future. The next recommendations are coming on the content approach for the LinkedIn account for our executive director, Emer Cook. This is a very important channel for us because it's building trust and because it gives this human face to the agency. And it also gives us the chance to approach topics that, let's say, we can't approach in a news item, but they are still of interest for public health. The recommendations we got here were to expand the range of topics covered in articles and posts, to embrace rich media content formats, and to share more personal content to show the human side even more, because this is what people, even on LinkedIn, relate to. And this is something that we are already reflecting or trying to implement. So these recommendations are already taken into account. And as case studies, we can mention here that we approach topics on a more general level or on a more personal level for Emer, such as the use of artificial intelligence in medicine regulation or the 3 Rs, but also the work that has been carried with patients and healthcare professionals. And even a personal post on recommendations of books. For August, we wanted to give a list to Emer's followers on her three main books she's reading, and there was a lot of engagement with more recommendations, and this is something that we will replicate also for winter. So such content will be tested further. I'm not sure how many of you know that we are actually present on Instagram as part of a joint account with ECDC, with EFSA, ECHA, and EEA. So these are the ENVI agencies, the agencies that have um, their work on the One Health approach. Basically, we are part of a joint project, and we are trying to provide content on health-related topics. And the recommendations we got here in the strategy is to use more popular science hashtags to reach less experienced audiences, and to try different formats like Q&As with the experts, video testimonials, rich media posts like carousels, and also joint campaigns with other EU agencies. Looking at these recommendations, we are already exploring different formats like quizzes or video testimonials. That was also a new format that was tested here in the team. And we are also looking in the future, we may be able to test some quizzes or influencer campaigns based on our available resources. But we also need to take into account the limitations that this project brings, in the sense that we are 5 agencies working at the same, trying to allocate time slots for our individual topics, and we need to take into consideration the other agencies' needs, and also this brings, in terms of technical aspects, some limitations. So we will try to grow this channel, but at the same time we have to be aware of the fact that it's a joint project, and yeah, we depend on the others. YouTube is also a very interesting platform that we may want to explore more. The recommendations from the contractor on the strategy is that we need to have more work done here, in the sense of creating shorter video elements, cleaning better the channel, as we have many videos, and it's quite busy right now and difficult to find to make sense of our content for the users that are not so used with our content, embracing new formats, and collaborating with you-based vloggers. And for now, our priorities is to indeed allocate some resources and time to streamline the channel according to the recommendations, and try to test more of short videos with, as I said, with people in them, so we can create this connection with our audiences and grow a bit more the YouTube platform. The content strategy on, I'm still calling it Twitter, but now everyone is referring to it as X. It's a bit of a challenge for me, but yeah. So for X, things are a bit, how can I say, they're not very clear now, because many changes are taking place. And we did receive some recommendations on what to do and what to embrace on Twitter, but practically speaking, what we will do is to share mostly the newsworthy content on Twitter, and to have a more strategic approach in using tagging and hashtags. And at the same time, we will follow closely what the European Commission will do, and what the European Commission will share in terms of guidelines on the approach for the X, given all the changes and paywalls that are being implemented lately. So maybe as additional information, also the Commission is having the same approach as us, or we have the same approach as the Commission, in the sense that our in terms of engaging with our audiences, we do put more emphasis on LinkedIn, because of the unpredictable nature now on this platform, and we keep only the newsworthy elements there. For the community management across all channels, we did receive quite a few ambitious recommendations in terms of being more reactive by responding to direct queries from followers, or engaging with comments and messages on third-party profiles. Also building EMA's community through thought leadership and mitigating risks by drawing up clear moderation guidelines for the users that are interacting with our channels. Looking carefully at these recommendations, we decided to focus more on the thought leadership part. So we want to use highly engaging formats, like I mentioned, the LinkedIn Live, based on content created on knowledge and contribution of our experts and also experts from our committees and partners. And we would also like to prepare a staff ambassador guidance for EMA colleagues, because this is also a way to disseminate better the information and to expand or to widen our reach and followership. At the same time, we would also want to look closely to our moderation guidelines and update them every 2 years. The next part is about monitoring and reporting. So we did receive a number of, let's say, KPIs that can help us to better reach each of our 3 goals that I presented in the beginning. Namely positioning EMA as an authoritative entity, maintaining and growing our current followership, and widening our audiences. In this sense, our priorities will be to prepare quarterly monitoring reports based on a clear set of KPIs that we are looking into it, and using these reports to better tailor or to better direct our efforts to promote our work on social media. And finally, we received also a number of recommendations on social media listening. Social media listening is actually very important to understand the conversation around the EMA and the work that we are doing, but also to help identifying topics or areas where there is a lot of or it's a huge amount of false narratives. So the recommendations were to listen to brand-related conversations and to broader topics, and to have a proactive identification of disinformation through third-party research, cooperation with social media platforms, which it's not always very easy to be done on, let's say, one organization level, given how ample and how complex these companies are, and also to address disinformation directly by creating our own content to debunk disinformation. What we are doing, though, based on recommendation, is to prepare a framework to tackle disinformation and misinformation, aiming to guide the EMA and the EU Medicines Network to deal better with false narratives about the agency's work. And actually, my colleague Sophie Labe will give you more information about this area. And that would be all. Thank you very much. I hope it wasn't too long.